the system has further improved for their comfort and our, their flexibility and not to hinder other passengers, as well as for us to do it in a bit of a simple manner. That is to get the through the manifest, we identify the passengers from those three countries in the plane itself. So therefore, they need not to be escorted to the main building. They are straight away taken to the domestic arrival, and then it's. But I don't say that we don't have resource limitations. Obviously, we have resource limitations. Now, for example, so therefore, we are sort of improving the search capacity. And I have to say that WHO is going to purchase some equipment and other medical requirements in a emergency manner for I think for about $100,000 worth equipment. We are going to repair some of the ventilators which can be repaired. Now, as of now, the private sector is not allowed to do this case, right? But then the government is considering whether to allow the private sector to do this test. So when you consider, now when it comes to other things, the price factor is the main factor for people. But here, it's not only the price factor, there are other factors. Because we are trying to control COVID-19. We are trying to stop introduction of COVID-19 infection in Sri Lanka and trying to control the spread, right? So it is a public health exercise. So the private hospitals generally in Sri Lanka are not much geared into public health, exercises. But when it comes to government, we have public health arm and the curative arm, right? So they work like hand and glove, right? So therefore we have to give this to private sector on very stringent criteria, because we in the government sector do these tests based on stringent criteria. So therefore we may have to, if we are going to allow them to test, we may have to have certain criteria, and we may have to ask them to report about the details of patients whom they have. That is useful for us to even follow up these patients, right? So the price factor, of course, it's a common factor. Price has to be reasonable. I would say has to be very reasonable. We have the epidemiology unit, right? We have regional epidemiologists. That means every district has got a regional epidemiologist. And then we have medical officers of health. They are in charge for public health of a certain area, right? So we have 300 of such areas. So that is the network how we implement this follow-up. And under every medical officer of health, there are public health inspectors. It is the public health inspector who generally visits these patients. But I would say sometimes the medical officer of health himself or herself do a primary inspection visit, in certain cases. For example, when it comes to these two cases, even the chief MOH of Colombo visited this case. Depending on the requirement. And then they have to do that for 14 days. And once that 14 days is over, they have to send their report back to the epidemiology unit. And this process is supervised and governed by the regional directors of health services and the provincial directors of health services.